When I pulled back the blanket and saw what they had let happen to my mother's body, I understood that her black skin hadn't hidden the problem at all. The staff had simply chosen not to look. For 3 months, while nurses marked "skin check completed" on her chart, my mother had been lying on open wounds so deep I could see bone. The smell hit me first, rot and infection, the smell of flesh dying while she was still alive. And when I screamed for help, when I demanded to know how this could have happened, a nurse looked at me with barely concealed annoyance and said the words I will never forget. "It's harder to see pressure sores on black skin. They don't show redness the same way. We can't be expected to catch everything." My mother had been begging them to check her for weeks. She had told them something was wrong, and they had looked at her dark skin, decided that nothing was visible and walked away. Again and again and again, until her body was rotting beneath her. My mother's name is Patricia Williams, but everyone who knows her calls her Miss Patty. She worked as a teacher's aide for 35 years, raised 4 children on her own after my father died, and volunteered at our church until her health made it impossible. She was the kind of woman who could make you feel loved and accountable in the same breath, who kept a spotless house and always had food ready for anyone who walked through her door. She was strong. She was proud. And she did not deserve what happened to her. If you're here for true stories that expose how medical racism kills black patients every single day in facilities across this country, subscribe to this channel and turn on all notifications right now. Because what happened to my mother is not rare. It's not an isolated tragedy. It's a pattern of neglect and abuse that happens when black skin is treated as a complication instead of something to protect. Mom had a stroke 14 months ago. It was relatively mild. She didn't lose her ability to speak or think clearly, but it affected her mobility on her left side and required extensive rehabilitation. After 2 weeks in the hospital, she was transferred to Riverside Manor, a skilled nursing facility that was supposed to provide physical therapy and help her regain independence before she could come home. The place looked good on paper. High ratings, certifications, clean and modern. We toured it before she was admitted, and everything seemed fine. The staff was friendly. The rooms were bright. Other residents looked well cared for. I should have noticed that almost all of those residents were white. I should have asked more questions about the handful of black residents I saw, about where they were and how they were doing. But I was overwhelmed and scared and desperate to believe that this place would help my mother get better. So I signed the admission papers, and I trusted them to take care of her. The first few weeks seemed okay. I visited almost every day after work, and Mom was making progress in physical therapy. She was frustrated by how slowly her body was recovering, but she was trying. The staff seemed attentive enough. Nurses came in to check vitals. Aides helped her with meals and bathing. Therapists worked with her on exercises. But Mom started complaining about discomfort pretty quickly. Her back hurt. Her hips hurt. The bed was too hard. She felt like she wasn't being moved enough, like she was lying in the same position for too long. I mentioned this to the nurses multiple times. They smiled and nodded and said they would make sure to reposition her more frequently, but Mom kept saying the same things. "My back is really hurting, baby," she'd tell me. "Something doesn't feel right. Can you ask them to really look at it? Not just ask me if I'm okay, but actually look." I did ask. I asked nurses, I asked aides, I asked the shift supervisor. Every time, I got the same reassuring response. "We're doing skin checks twice a day. Everything looks fine." Older patients often have aches and pains, especially during recovery. "We're monitoring her closely." But they weren't. They weren't monitoring her closely at all. They were doing the bare minimum, opening the door, asking if she was comfortable, maybe glancing at her while she was fully covered with blankets, and then marking their charts as if they'd done a thorough examination. About 6 weeks into her stay, I arrived one evening to find Mom unusually quiet. She wasn't her normal self, cracking jokes, asking about my day, complaining about the food or the noise in the hallways. She was withdrawn, almost fearful. When I asked what was wrong, she hesitated before saying, "I told the day nurse my hip was really hurting and asked her to check it." She barely looked, just pulled back the blanket for a second, and said she couldn't see anything wrong. "But baby, it hurts. It hurts bad. And I think something is there. Something bad. Did she actually examine you? Touch the area, feel for heat or swelling?" "No." She just looked from the doorway and said black skin doesn't show problems as well as white skin, so if she couldn't see anything red, it was probably fine. Then she left. I felt a cold knot form in my stomach. She said what? That black skin hides redness. That she can't always tell if something's wrong just by looking. But baby, I can feel it. Something is very wrong. I want to find that nurse immediately. When I explained that my mother was in pain and needed a proper examination, she gave me a patient smile that made my skin crawl. I understand your concern, she said, but we do check her regularly. The thing is, with darker skin tones, the early warning signs of pressure injuries, redness, initial inflammation, don't present the same way they do on lighter skin. It makes early detection more challenging. But we're trained to look for other signs, and I haven't seen anything concerning. Have you felt her skin? Checked for warmth or swelling by touch? She paused. I've done a visual assessment. That's not the same thing. My mother is telling you she's in pain. She's asking you to actually examine her, not just glance at her from across the room. The nurse's smile tightened. I appreciate your advocacy for your mother, but I need you to trust that we're professionals. We know how to assess our patients. If there were a serious issue, we would have caught it. But they hadn't caught it, and they wouldn't catch it until it was far too late. Over the next month, Mom's complaints became more desperate. She told me her back felt like it was burning, that she felt wetness sometimes, like her skin was weeping, that she was afraid to move because it hurt so much. Every time I reported this to staff, I got the same responses. We've checked. Everything looks fine. She's probably just sore from therapy. Older patients tend to be more sensitive to discomfort. One aide, a young black woman named Tasha, pulled me aside one day and said quietly, "You should check your mother yourself. Really check her. Don't just take our word for it." Before I could ask what she meant, she hurried away that I tried to examine Mom myself during visits, but she was in so much pain that she would cry out when I tried to move her. The staff discouraged me from disrupting her care routine and suggested I visit during designated family hours when they'd already made her comfortable for the day. I didn't understand then that comfortable meant they'd already positioned her and didn't want to move her again because it would reveal what they'd been hiding. It was 3 months to the day after Mom was admitted when I showed up for an unannounced visit on a Saturday morning. I arrived early, before the breakfast shift, before the daily routines that I'd been encouraged to schedule my visits around. And I found my mother in a state I will never be able to forget. She was crying. Not loudly, soft, broken sounds that suggested she'd been crying for a long time and had run out of energy for anything more. She was trying to shift her position in bed, her face contorted with agony, her breath coming in shallow gasps. The smell in the room was wrong, sweet and rotten at the same time, like something dying. "Mom, what's wrong? What hurts?" "Everything," she whispered. "My back, my hips, my heels. Baby, I think I'm rotting. I think I'm dying and they won't help me." I yanked back the blanket, and I saw hell. The wounds on my mother's body were beyond anything I could have imagined. On her lower back, just above her tailbone, was an open sore the size of my palm. The skin around it was black and dead, and the center was a crater of exposed tissue that glistened with infection. On her left hip, another wound, smaller but just as deep, the edges ragged where the skin had simply given up and pulled away from the dying flesh beneath. And on both heels, dark areas that I realized with horror were also pressure sores, the skin broken and weeping fluid. I started screaming. I don't remember what I said, just that I was screaming for help, screaming for a nurse, screaming that my mother was dying while they'd been checking boxes on charts and lying about her care. Staff came running, and I saw their faces change when they saw what I'd uncovered. Not surprise. Guilt. "How long?" I demanded. "How long have these been here?" "We need to assess," one nurse started. "Don't you dare. Don't you dare tell me you need to assess something you should have been assessing every single day. These wounds are huge. They're infected. They didn't appear overnight. How long have you been lying about checking her?" No one would answer me. They called the facility's medical director, a doctor who examined my mother, and then stepped out into the hallway where I could hear him on the phone. "Yes, we need wound care immediately. Multiple stage 4 pressure ulcers. Significant infection. Yes, I know. I'm looking at the charts now and they don't match what I'm seeing. We have a serious problem. A serious problem. My mother had been lying on open wounds for weeks, maybe months, while staff marked their charts with fabricated skin checks. And the only reason it had been allowed to happen was that her black skin didn't show the early warning signs that they'd been trained to recognize on white skin, and instead of learning how to properly assess dark skin, they'd simply decided that if they couldn't see it easily, it wasn't their problem. Mom was transferred to the hospital within the hour. The ER doctor who examined her couldn't hide his shock. "These are some of the worst pressure injuries I've seen in years of emergency medicine," he said. "Stage 4 ulcers with bone involvement. She's septic. The infection has spread to her bloodstream. We need to get her into surgery immediately to debride the dead tissue and start aggressive 4 antibiotics. I need to be honest with you, this is life-threatening. And it was completely preventable. The nursing home said they couldn't see problems on her skin. That black skin hides redness." His expression hardened. "That's not an excuse. That's negligence, dressed up in medical language. Yes, erythema, redness, can be harder to detect on darker skin tones in the very early stages of pressure injury development. But that's exactly why healthcare providers are supposed to use tactile assessment, not just visual. You feel for warmth, for firmness, for changes in tissue consistency. You ask the patient about pain and discomfort. You actually examine them, not just glance at them from a doorway. And you reposition immobile patients every 2 hours without fail. These wounds didn't form because your mother's skin hid the problem. They formed because no one bothered to look properly. The surgery took 4 hours. They removed dead tissue from all 3 major wound sites, cultured the infection, and started her on multiple antibiotics for the sepsis that was trying to kill her. The surgeon told me afterward that the wound on her back had exposed her sacrum, the triangular bone at the base of the spine, and that there was evidence of osteomyelitis, bone infection, which would require months of treatment. "Will she recover?" I asked. "From the infection? Probably, with aggressive treatment. But these wounds will take months to heal, if they heal completely at all. She'll need specialized wound care, multiple surgeries possibly, long-term antibiotics. Her mobility will be compromised. She won't be able to sit or lie on these areas while they heal, which makes rehabilitation nearly impossible. And there's permanent tissue damage. Your mother is going to live with the consequences of this neglect for the rest of her life." I spent that first night in the ICU beside my mother's bed, watching machines monitor her vital signs, watching bags of antibiotics drip into her veins, watching her sleep a medicated sleep that was nothing like the peaceful rest she deserved. And I thought about every time she told me something was wrong, every time she'd asked someone to really look, every time she'd been dismissed with excuses about how her skin made it hard to see problems. The next morning, I went to Riverside Manor with my brother and demanded to see my mother's complete medical records. The administrator tried to delay, to schedule a meeting, to offer sympathetic words about unexpected complications. I told him he could give me the records immediately, or I could call the police and report elder abuse. He gave me the records. Reading through them was like reading fiction. According to the charts, my mother had received comprehensive skin assessments twice daily for 3 months. The notes said things like skin intact, no areas of concern, and patient reposition per protocol, no redness or breakdown noted. There were checkboxes for every shift indicating that she'd been turned every 2 hours. All lies. All of it. But there were also clues to the truth if you knew how to read between the lines. Notes that said patient complains of back pain followed by educated patient on normal discomfort during recovery. Notes that said patient difficult during care, refused repositioning. When I knew my mother would never refuse care, she'd been begging for it. And there, buried in the nursing notes from 6 weeks earlier, a single line that made my blood boil. Skin assessment challenging due to patient's complexion. No obvious discoloration noted. They'd known. They'd known that they couldn't properly assess her skin with just a visual check, and instead of adjusting their method, they'd simply documented that they couldn't see anything and moved on. My mother's dark skin hadn't hidden the problem. It had given them permission to stop looking. I took the records to a lawyer who specialized in nursing home negligence. He read through them, looked at the photos I'd taken of my mother's wounds in the hospital, and shook his head. "This is one of the clearest cases of neglect I've seen," he said. "Stage 4 pressure ulcers don't develop overnight. They progress through stages over weeks. At any point during that progression, Proper assessment and intervention would have prevented this. The fact that they documented regular skin checks while these wounds were forming is evidence that they either didn't do the checks at all, or they did them so inadequately that they might as well not have bothered. They blamed her skin, I said. Multiple nurses told me that black skin hides problems. That's medical racism, he said bluntly. It's a known issue in healthcare. Medical education has historically used white bodies as the standard, so providers are often underprepared to assess conditions on darker skin. But that's not an excuse for negligence. It's a reason to be more careful, more thorough. There's extensive literature on how to properly assess dark skin for pressure injuries, for rashes, for any number of conditions. The information exists. If the staff at Riverside Manor didn't know how to do it properly, that's a training failure. And if they did know but didn't bother, that's willful neglect. He agreed to take the case. But he also warned me that nursing home litigation is difficult, that facilities have powerful legal teams and insurance companies that will fight to minimize payouts, and that even when families win, the monetary compensation rarely feels like justice. I don't want money, I said. I want them to admit what they did. I want consequences for the people who let my mother rot. I'll do my best, he said. But I need you to prepare yourself for the reality that the system is designed to protect facilities, not patients. We'll fight, but it won't be easy. He was right. It wasn't easy. Riverside Manor's lawyers immediately went on the offensive, claiming that my mother's wounds were the result of her own noncompliance with care, that she refused to be repositioned, that her diabetes made her more susceptible to pressure injuries, that the progression from stage 1 to stage 4 happened unusually fast due to underlying health conditions. They produced expert witnesses who testified that pressure ulcers can be difficult to prevent in elderly patients with limited mobility. But we had our own experts, wound care specialists who looked at the timeline and the photographic evidence and testified that these injuries showed chronic, prolonged pressure without adequate relief, that the infection indicated the wounds had been open for weeks, possibly months, that proper turning and repositioning protocols would have prevented this entirely, and that the claim that my mother refused care was contradicted by her own documented complaints about not being moved enough. And we had the smoking gun, those notes about her complexion, making assessment challenging. Our lawyers brought in research showing that healthcare providers routinely undertreated pain, misdiagnoses, and provided inadequate care to Black patients because of gaps in medical education about darker skin tones. They showed that the standard pressure ulcer staging system relies heavily on visual identification of redness, something that appears differently on dark skin, and that facilities serving diverse populations have a responsibility to train staff in proper assessment techniques that don't rely solely on visual cues. The case took 18 months to reach settlement. Riverside Manor never admitted fault, but they paid. They paid for my mother's medical expenses, for her pain and suffering, for the permanent disability their neglect had caused. The amount was substantial, but it felt meaningless. No amount of money could give my mother back the months of agony, the permanent damage to her body, the trauma of being ignored and dismissed while her flesh rotted beneath her. During those 18 months of legal proceedings, my mother lived with wounds that wouldn't heal. The infection cleared with antibiotics, but the tissue damage was so severe that healing required specialized care, wound vacs that created negative pressure to promote tissue growth, multiple debridement procedures to remove dead tissue, hyperbaric oxygen therapy, skin grafts. She spent months unable to sit normally, unable to lie on her back, her life circumscribed by the limitations of a body that had been fundamentally damaged by neglect. But the physical wounds were only part of it. The psychological trauma ran deeper. Mom developed severe anxiety around medical settings and medical personnel. She would panic when nurses approached her, convinced they were lying about examining her, convinced they would let her suffer because they couldn't be bothered to look properly. She had nightmares about being back at Riverside Manor, about lying in her own filth while staff walked past her room. She would wake up crying, asking me to check her skin, terrified that wounds were forming again without her knowing. I told them, she would say over and over. I told them it hurt. I told them something was wrong. Why didn't they listen to me? I didn't have an answer that would make it better. The truth, that they didn't listen because she was Black, elderly and on Medicaid, and therefore not worth the extra effort of a thorough examination, was too painful to say out loud, even though we both knew it. We brought her home as soon as she was stable enough. I quit my job to become her full-time caregiver because neither of us could stomach the idea of another facility, another set of strangers who might or might not actually care whether she lived or died. I learned how to do wound care, how to change dressings, how to watch for signs of infection. I learned how to reposition her every 2 hours, day and night, because the fear of more pressure sores was constant. And I learned how common this was. As I connected with other families through support groups and advocacy organizations, I heard the same story again and again. Black patients whose pain wasn't taken seriously, whose symptoms were dismissed as exaggeration, whose skin conditions weren't properly diagnosed because providers didn't know what eczema or cellulitis or pressure injuries looked like on dark skin, whose very blackness was used as an excuse for inadequate care. I met a woman whose father died from sepsis that started in an undetected pressure sore. The nursing home had documented skin checks for weeks while he was developing a stage 4 ulcer on his heel. When the family complained that he was in pain, they were told that dark skin doesn't show problems until they're advanced, and that the staff was doing their best. By the time someone actually examined him properly, the infection had spread to his bone and bloodstream. He died 6 days later. I met a mother whose teenage son, a dark-skinned black boy who used a wheelchair, had severe pressure sores that went unnoticed by school nurses for months. When she finally discovered them during bath time at home and confronted the school, they claimed they'd been checking his skin daily but couldn't see any discoloration. The boy needed surgery and months of healing. The school's only consequence was a policy change requiring nurses to document tactile assessment. Not just visual, a policy that should have been standard all along. The pattern was clear and horrifying. Black skin was being treated as a barrier to care rather than something requiring adapted care. Medical professionals, who couldn't be bothered to learn how to properly assess darker skin tones, were using that lack of knowledge as an excuse for negligence. And patients were dying or being permanently harmed as a result. I started researching the medical literature on this issue. What I found was both validating and enraging. Study after study confirmed that medical education has a racial bias problem. Most medical textbooks feature almost exclusively white skin when teaching about rashes, bruising, pressure injuries, cyanosis, and other visual symptoms. Dermatology atlases overwhelmingly show conditions on light skin. Medical students report feeling unprepared to diagnose conditions on patients of color because they've never been taught what those conditions look like on darker skin tones. This gap in education has deadly consequences. Black patients are less likely to have melanoma detected early because providers don't know what suspicious moles look like on dark skin. They're less likely to have sepsis recognized quickly because the skin discoloration that signals poor circulation is harder to see. They're more likely to have advanced pressure ulcers because the redness that marks stage 1 injury is missed. And the solution isn't complicated. It's not rocket science. It's training providers to use tactile assessment along with visual. It's teaching them what conditions actually look like on a range of skin tones. It's listening to patients when they report pain or discomfort instead of dismissing their concerns because you can't see obvious visual confirmation. It's treating black skin with the same care and attention that white skin receives. But that would require the medical system to acknowledge that white bodies have been centered as the default, that this has caused harm, and that change is necessary. And from what I'd seen, the system was far more interested in protecting itself than in protecting black patients. Riverside Manor's response to my mother's case was typical. After the settlement, they released a statement saying they'd review their protocols and provided additional staff training on pressure injury prevention. But when I contacted families of other black residents, families I'd met during my months of visiting Mom there, I heard that nothing had actually changed. Staff still relied primarily on visual assessment. Black residents were still disproportionately developing pressure sores. The additional training had been a single PowerPoint presentation that most staff had clicked through without reading. The facility faced no sanctions from the state, no loss of license or certification. The surveyors who investigated after my complaint found deficiencies in care, but categorized them as low-level violations that required a plan of correction rather than immediate remediation. The plan of correction was submitted, approved, and filed away. And Riverside Manor continued operating, continued accepting vulnerable elderly patients, continued providing the same inadequate care that had nearly killed my mother. I wanted more than money. I wanted accountability. I wanted the nurses who had falsified skin check documentation to lose their licenses. I wanted the administrators who had failed to train their staff properly to face consequences. I wanted the system that had allowed this to happen to fundamentally change. But I was learning that individual accountability is rare in cases of systemic negligence. The nurses claimed they'd been following facility protocols. The facility claimed they'd been following industry standards. The industry claimed that pressure ulcers are an unavoidable complication of caring for elderly, immobile patients. Everyone passed the blame, and no one took responsibility. The only person who faced real consequences was my mother. She lived with the consequences every single day. The pain, the restricted mobility, the fear, the knowledge that her body had been allowed to rot because people who were supposed to care for her couldn't be bothered to actually look. And she lived with the knowledge that her blackness had been weaponized against her, that the very skin she'd lived in her whole life, skin she taught me to be proud of, skin that had weathered every storm and indignity that America throws at black women, that skin had been used as an excuse to let her suffer. About a year into Mom's recovery, when the wounds had finally closed enough for her to sit for short periods, and we developed a routine for her care at home, she asked me something I wasn't prepared for. Do you think they would have let this happen to a white woman? I wanted to lie. I wanted to tell her that this was about understaffing or individual bad actors or bad luck. But she deserved the truth. No, I said. I don't think they would have. She nodded slowly, like she'd known the answer but needed to hear me confirm it. I knew it, she said. When they kept telling me they couldn't see anything wrong, when they kept dismissing me, I knew it was because I was black. Because I was old and black and on Medicaid. Because to them, I wasn't worth the extra 30 seconds it would have taken to actually touch my skin and check if it was warm or breaking down. They looked at me and decided I didn't matter enough. You matter to me, I said, crying. You matter so much. I know, baby, but I didn't matter to them. And that's what hurts most. Not even the wounds, though God knows they hurt. It's knowing that people looked at my suffering and chose to walk away. That my body was rotting, and they wrote it down as no problems found because actually checking would have been inconvenient. She was right, and her pain was echoed in every story I heard from other black families, every statistic I read about healthcare disparities, every study documenting how black patients' pain is undertreated and their symptoms dismissed. Black patients wait longer in emergency rooms, even when they have the same conditions as white patients. Their pain is rated as less severe by providers, leading to less pain medication prescribed. Their symptoms are more likely to be attributed to psychological causes rather than investigated medically. And when they die from preventable conditions, their deaths are more likely to be categorized as unavoidable complications rather than failures of care. The pressure sore issue is just one example of a much larger pattern. Medical devices like pulse oximeters are less accurate on darker skin, leading to missed cases of low oxygen levels. Algorithms used to guide treatment decisions have racial bias built into them. Conditions like postpartum hemorrhage and sepsis are diagnosed later in black patients because providers don't recognize the visual signs on dark skin. And throughout all of this, black patients are blamed for their own poor outcomes. They're accused of noncompliance when they question treatment. They're labeled as difficult or demanding when they advocate for themselves. Their legitimate complaints about pain or discomfort are dismissed as exaggeration or drug-seeking behavior. My mother had experienced all of this at Riverside Manor. When she complained about pain, she was labeled as difficult. When she asked staff to examine her more thoroughly, she was accused of being demanding. When her body broke down from neglect, the facility blamed her diabetes, her age, her skin tone, anything except their own failure to provide basic care. I filed complaints with every oversight body I could find: the State Health Department, Medicare, the Long-Term Care Ombudsman, professional licensing boards for the nurses involved. Most of these complaints went nowhere. The State Health Department did an investigation and found violations, but the penalties were minimal. Medicare noted the deficiencies but didn't revoke the facility's certification. The licensing boards reviewed the nurses' conduct and found that while their documentation was inadequate, it didn't rise to the level of license revocation. The ombudsman was the only person who seemed genuinely horrified by what had happened. She visited my mother at home, looked at photos of her wounds, reviewed the records, and told me bluntly, This is one of the worst cases of neglect I've encountered. But the system isn't designed to hold facilities accountable. It's designed to keep beds filled and money flowing. Unless there's a death that makes the news, facilities can get away with almost anything. So what's the point of all these oversight agencies if they won't actually do anything? They'll make the facility fill out paperwork and promise to do better. They'll fine them a few $1,000s, which is nothing compared to the revenue they bring in. And then everyone moves on. Except the victims. The victims carry it forever. She was right. Mom would carry this forever. The wounds had mostly healed after a year and a half of intensive treatment, but the scars remained. Physical scars on her back and hips and heels, and deeper scars in her mind and spirit. She would never fully recover her mobility. The muscle and tissue damage was too severe. She would spend the rest of her life in pain, taking medications to manage nerve damage and chronic inflammation, living in fear that any small pressure point might develop into another catastrophic wound. And she would never trust healthcare providers again. Every doctor's appointment was torture for her because she was convinced they weren't really examining her, weren't really listening, were just going through the motions until they could dismiss her and move on to a patient they considered more worthy of their time and attention. I became her advocate in every medical interaction. I questioned everything. I demanded thorough examinations. I refused to accept everything looks fine without detailed explanation. I made doctors uncomfortable with my insistence that they actually touch my mother's skin, actually listen to her complaints, actually take her seriously as a patient rather than as a box to check. Some providers appreciated this. They recognized that I was protecting my mother from a system that had already failed her catastrophically. But others resented it. They saw me as an overprotective, difficult family member who didn't trust medical professionals. They didn't understand, or didn't care to understand, that my distrust had been earned through watching my mother's flesh rot while providers told me everything was fine. About 18 months after we brought Mom home, she developed a small pressure area on her heel. Just a darkening of the skin, a subtle change that I caught because I was checking her obsessively every day. We immediately saw a wound care specialist, implemented aggressive offloading and treatment, and prevented it from progressing. The fact that we caught it early, that we stopped it before it became an open wound, felt like a victory. But it also felt like proof that if Riverside Manor staff had done even the bare minimum of actual assessment, Mom's catastrophic wounds would never have happened. That small pressure area that we caught and treated successfully made the neglect even more inexcusable. It showed how easy it is to prevent these injuries if you're actually paying attention, actually caring, actually treating your patient like a human being whose suffering matters. But Riverside Manor staff hadn't done that, and they had faced no real consequences for their failure. It's been 3 years now since I pulled back that blanket and saw what they'd let happen to my mother's body. 3 years of wound care and pain management and physical therapy and trauma counseling. 3 years of fighting a system that protects institutions over individuals, profits over patients, whiteness over everyone else. Mom is alive. Against the odds, despite the sepsis and the bone infection and the tissue death, she survived. But survival isn't the same as recovery, and recovery isn't the same as justice. She lives with me now, in a hospital bed in what used to be my dining room. We've made it as comfortable as we can. Family photos on the walls, her favorite gospel music playing softly, sunlight through the windows. She can sit up for a few hours a day now without too much pain. She can laugh sometimes, though the laughter is quieter than it used to be, more careful, like she's afraid of taking up too much space or being too loud or bothering anyone. The woman who used to command a room, who used to sing at the top of her lungs while cooking Sunday dinner for half the neighborhood, has been diminished by what was done to her. Not just physically, though the physical limitations are real and permanent, but spiritually. The confidence and joy that used to radiate from her has been dampened by the knowledge that when she was most vulnerable, people chose not to see her suffering because her skin made it easier to look away. I think about that phrase constantly. Black skin hides problems. It's become a symbol for me of everything wrong with healthcare for Black patients. Because black skin doesn't hide problems, it reveals them. It reveals that medical education is inadequate. It reveals that providers are undertrained or unwilling to adapt their assessment techniques. It reveals that some healthcare workers will choose the easy path of ignorance over the slightly more effortful path of actually examining their patients properly. It's been 3 years now since I pulled back that blanket and saw what they'd let happen to my mother's body. 3 years of wound care and pain management and physical therapy and trauma counseling. 3 years of fighting a system that protects institutions over individuals, profits over patients, whiteness over everyone else. Mom is alive, against the odds, despite the sepsis and the bone infection and the tissue death she survived. But survival isn't the same as recovery, and recovery isn't the same as justice. She lives with me now, in a hospital bed in what used to be my dining room. We've made it as comfortable as we can. Family photos on the walls, her favorite gospel music playing softly, sunlight through the windows. She can sit up for a few hours a day, now without too much pain. She can laugh sometimes, though the laughter is quieter than it used to be, more careful, like she's afraid of taking up too much space or being too loud or bothering anyone. The woman who used to command a room, who used to sing at the top of her lungs while cooking Sunday dinner for half the neighborhood, has been diminished by what was done to her. Not just physically, though the physical limitations are real and permanent, but spiritually. The confidence and joy that used to radiate from her has been dampened by the knowledge that when she was most vulnerable, people chose not to see her suffering because her skin made it easier to look away. I think about that phrase constantly. Black skin hides problems. It's become a symbol for me of everything wrong with healthcare for Black patients. Because black skin doesn't hide problems, it reveals them. It reveals that medical education is inadequate. It reveals that providers are undertrained or unwilling to adapt their assessment techniques. It reveals that some healthcare workers will choose the easy path of ignorance over the slightly more effortful path of actually examining their patients properly. And it reveals that in America, Blackness itself is treated as a complication, an inconvenience, a barrier to the simple, easy care that white bodies receive as a matter of course. I've spent these 3 years trying to make something meaningful out of Mom's suffering. I speak at nursing schools and medical schools about the importance of learning to assess all skin tones. I train families on how to advocate for their loved ones in care facilities, how to document concerns, how to recognize signs of neglect. I push for policy changes that would require facilities to have staff trained specifically in assessing pressure injuries on darker skin. Some people listen. Some providers genuinely want to do better and appreciate the education. But so many others get defensive, insist that they treat all patients the same, refuse to acknowledge that treating everyone the same means treating Black bodies as if they're white bodies and then blaming those bodies when they don't respond the same way. Riverside Manor is still operating. Still has good ratings on most review sites because bad reviews get buried or removed if facilities complain. Still accepts Black and brown patients on Medicaid and still, according to families I've stayed in touch with, provides substandard care that disproportionately harms those patients. Nothing fundamental has changed. The legal settlement included a gag order that we negotiated away partially so I could tell Mom's story publicly. The facility didn't want me speaking out, but our lawyer fought for my right to advocate and educate. So I can tell you what happened, though I can't use certain specifics that might identify individual staff members or violate the settlement terms. What I can tell you is this. If you have a Black loved one in a nursing home or hospital or any care facility, do not trust that they're being properly assessed. Advocate loudly. Visit frequently and at random times. Ask specifically about skin checks and insist they be done tactically, not just visually. Question any complaint your loved one makes about pain or discomfort. Take photos to document their condition over time. Trust your loved one when they say something is wrong, even if providers tell you they can't see anything. Because they might not see it, not because it's hidden, but because they're not looking properly. And by the time damage becomes visible even to untrained eyes, it may be too late to prevent permanent harm. Subscribe to this channel and turn on all notifications for more true stories exposing medical racism and healthcare negligence. And if you've ever had a Black loved one whose pain or symptoms were dismissed by medical providers, drop a heart in the comments below. You're not alone. Your experience was real. And your loved one deserved better. My mother deserved better. She deserved nurses who would have actually examined her when she complained of pain. She deserved a medical system that saw her dark skin as something to protect, not as an excuse for inadequate care. She deserved to grow old with dignity, not to have her body rot beneath her while people walked past her room and marked, "No problems found," on charts they barely glanced at. She deserved the same care that white patients receive as a baseline expectation: to be seen, to be heard, to be believed, to be examined thoroughly, to have her pain taken seriously. Instead, she got excuses. She got blame. She got providers who used her blackness as justification for their own failures. And she got wounds so deep I could see bone. Wounds that will leave scars on her body for whatever time she has left. Wounds that developed because when people looked at her dark skin, they decided it was easier to claim they couldn't see problems than to actually do the work of caring for her properly. Mom still has nightmares about Riverside Manor. She wakes up crying, reliving those months of lying on rotting flesh while being told nothing was wrong. In her darkest moments, she says she feels like her body betrayed her, like her skin, the skin she was born in, the skin she's lived in for 73 years, somehow failed to communicate her suffering loudly enough. But her body didn't fail her. Her skin didn't hide anything. The failure was entirely human, the failure of providers to care, to look, to listen, to treat her like she mattered. I tell her that constantly, that this wasn't her fault, that her skin is beautiful and strong and bore witness to what was done to her even when no one was willing to see, that the problem was never her blackness, but rather a medical system built on the assumption that white bodies are the standard and everyone else is a complication. Some days she believes me. Some days she even smiles and says she's glad she survived, glad she got to come home, glad she has family who fought for her when the system wouldn't. Other days, she just stares out the window, and I know she's thinking about those months at Riverside Manor.